Meet a healthy 30-year-old with an active lifestyle, regularly jogging and hitting the gym. Despite their youth, subtle joint wear begins unnoticed. Studies show 1 in 4 adults under 35 already show early signs of joint degeneration, often masked by high pain tolerance in active individuals. This scene highlights how modern fitness culture accelerates joint aging through repetitive, high-impact motions. Post-workout joint stiffness gets dismissed as normal soreness. Research reveals 68% of early joint damage cases begin with ignored morning stiffness lasting under 30 minutes. The bottle of over-the-counter painkillers on the nightstand represents how 90% of young adults self-medicate instead of seeking diagnosis. This behavior allows inflammation to progress unchecked. A general practitioner's vague diagnosis of normal aging reflects a systemic issue. 73% of early joint cases get misdiagnosed during initial consultations. The grainy X-ray shown lacks sensitivity to detect early cartilage erosion visible only through advanced imaging. This scene critiques healthcare's reactive rather than preventive approach to joint health. Biomechanical analysis reveals the truth. Flat feet causing 42% excessive medial knee load during movement, while weak glutes force hamstrings to overcompensate. These imbalances, present in 60% of urban populations, accelerate joint wear 3 times faster than normal. Computer modeling demonstrates how millimeters of misalignment multiply into years of premature degeneration. The specialist identifies daily hazards: 8-hour desk job causing hip flexor shortening, fashionable flat shoes providing zero arch support, and excessive stair climbing in high-rise apartments. Data shows office workers have 57% higher risk of early lumbar degeneration. This forensic approach connects mundane habits to long-term joint damage. Blood tests reveal CRP levels 3 times above normal, the consequence of a processed food diet high in omega-6s. Modern diets create a 17-to-1 omega-6 to omega-3 ratio versus the ideal 1-to-1. This biochemical environment fuels chronic inflammation that erodes joints silently, with 92% of patients unaware of their dietary impact on joint health. The 3T MRI delivers undeniable evidence: grade 2 chondromalacia patelli, with 30% cartilage thinning in weight-bearing zones. Compared to a healthy joint's pearly white cartilage, the damaged areas appear yellowish and frayed. This technology detects degeneration 5 to 7 years earlier than X-rays, allowing timely intervention before structural damage becomes irreversible. Targeted rehab begins with eccentric quadriceps strengthening, proven to reduce patellofemoral stress by 40%. Blood flow restriction training enables muscle growth with just 30% normal load. Research confirms 12 weeks of proper biomechanical training can redistribute joint loads more effectively than braces or medications alone. The nutrition protocol combines 1,500 milligrams daily omega-3s with collagen peptides shown in studies to increase cartilage thickness by 8% in 6 months. Turmeric and ginger provide natural COX-2 inhibition. Patients following this regimen report 67% greater pain reduction compared to standard treatments, addressing joint health at the cellular level. 1 year later, the same park scene now shows proper running form with activated glutes, customized orthotics, and a 12% slower pace that reduces impact forces. Follow-up imaging shows stabilized cartilage thickness. This proves that with early detection and multidisciplinary care, up to 80% of early joint aging can be halted or reversed, preserving mobility for decades.